everyone, this is Marika and welcome back to another session of Community Health Nursing. So in our previous sessions, we have discussed about what is community health, what is community health nursing, what are the different principles of community health nursing. We also discussed about what is health, the concept of health, dimensions of health as well. In the very last session, we have discussed about health promotion, where we discussed what is health promotion, what are the target groups of health promotion, what are the different principles that are to be followed to attain health promotion. In this session today, we are going to discuss the remaining aspect of health promotion, which includes health promotional strategies and health promotion through legislative approaches. And then we will also discuss a very short topic, that is health maintenance. Now let us quickly recall what health promotion was. Health promotion is any kind of activities that is carried out by an individual in order to attain, in order to maintain and restore his or her health. Any activity that helps an individual to not just restore their health after being suffered from a certain disease, but also to attain or to maintain the good health are the activities which can be termed as health promotion. Health promotion does not focus on curative, but it focuses on preventive measures, which means in health promotion, we do not only think about helping the people who are at risk of a certain disease, helping the people to achieve a pre-disease functioning, but also helping the people understand about importance of maintaining their health irrespective of their health status. Now, health promotion has various principles, and health promotions have certain target groups, which includes elderly, women and children, workers at workplace, etc. Let us now see health promotion through legislative approaches. Now, what does the term legislation or legislative means? Legislative are certain rules that the citizens of a particular state or a particular country has to follow. So health promotion through legislative approach is what health promotion can also be achieved by various laws or by enforcing various rules by the government. Such rules which will help an individual to prevent oneself from any kind of diseases, prevent oneself from any kind of illness can be termed as health promotional activities through legislative approaches. Whatever laws and regulations are already present, which are there for the health promotion, must be implemented, and any kind of new law that will help in promotion of health also must be integrated in legislative approaches. Now, there are already few of the laws that helps people to protect their health. For example, a law relating to the prevention of motor vehicle accident. There are few things that a driver must follow while the driver drives, right? For example, use of seat belts, not drinking alcohol or being fit at the time of driving, use of helmets while driving any kind of two-wheelers, and also laws related to control of environmental pollution. So these are few of the laws that are there, that are already present in order to help in health promotion. So whatever existing laws that we have must be implemented, and new laws that will help in health promotion also can be formed or also can be suggested, which will help in health promotion. Moving on, let us see what are health promotion strategies. So we know what is health promotion, how it can be achieved, what are the various principles, and who are the target group. Now, what are the strategies for achieving health promotion? One very interesting thing to remember here is that health promotion, when it is planned or when strategies for health promotions are selected, we can only choose a strategy or we can only make a strategy when we understand the social, cultural and economic background of the community, wherein we have to understand the health needs of the community. So according to the health need of the community, according to the social, cultural, economic and environmental system of the community, we have to plan health promotional strategies. So every time health promotional strategies, same health promotional strategies cannot be used for every different community, for every different group of individual. Of course, every community will have different culture, every community will have a different social background. And as healthcare professionals, we need to understand the community first. We need to have a good understanding of their social, cultural and environmental system. And we need to assess the health needs of the community, and then plan for health promotional strategies. There are a set of health promotional strategies that must be followed in order to help people achieve optimum health. Now, these are all common strategies that can be used in order to achieve health promotion. The first one is proper healthcare system. Now, what does proper healthcare system means? In many of the places, especially when we talk at a community level, there can be health centers, there can be primary health centers, there can be community health centers, but these centers may not be a well-functioning centers, or it might not provide a good service to the people in the community. Therefore, health services or health centers that are established must be a well-functioning health center, must be a good and properly arranged healthcare delivery system in order to help the people attain health promotion. So when we have a proper functioning in our healthcare system, when a healthcare system functions properly, it will help the people to understand about what are the various health needs of the people. Various primary and community health centers will help the people in the community understand and also participate in planning the health promotional activities, which will increase their interest, as well as people will understand about the importance of various activities that they have to carry out. Therefore, the very first strategy that we must have is a proper functioning healthcare delivery system at community level and also in various different levels. Now, what does a proper healthcare delivery system mean, or a proper health system means? Here, in healthcare delivery system, within, suppose it is a primary health center or it is a district hospital, all these hospitals or healthcare delivery system should have the departments that works in close collaboration with one another within the healthcare delivery system, and not just within the people of the organization, but also work in association with other people involved in health promotional activities. For example, health insurance companies, private and public healthcare delivery systems, pharmaceutical companies. So all of these organizations have a major role in the functioning or in helping the person to achieve good health. So all of these different departments also must work in close collaboration with the healthcare delivery system to help people attain health promotion. So the very first strategy is proper healthcare delivery system, wherein we need to have a proper healthcare delivery system at community level, at a district level, and at a state level. Proper functioning of the healthcare system will help the people to be involved in various activities at the community level. They will be involved in self-care activities, and they will also understand the importance of various health promotional activities. A proper healthcare system is what? A proper healthcare system is where all the departments within the healthcare system work in close collaboration for the well-being of their people, for the well-being of community people, and not just the departments within the hospital, but they also should work in close collaboration with other organizations, other companies that works towards health promotion. The next one we have is safe environment. Now, what does safe environment means? We all know how important our environment, any environment that a person lives in is, right? Environment plays a major factor in affecting the health of an individual. So health promotion can be achieved if the environment in which the person lives in is clean. If the environment that I live in is clean, if it is well maintained, then obviously it will help in prevention of various diseases, to avoid various disease. So it will help in achieving health promotion. Health promotion involves provision of safe water, control of rodents and vectors, improvement in the living standard of an individual, installation of toilets, and provision of good lighting. So all of these are the various physical factors that affects the health of an individual. So safe environment must be provided to an individual. What is a safe environment? A safe environment is an environment of the person wherein the person gets to live in a clean environment which has a good provision of water supply, installation of sanitary toilets, provision of clean air, and proper lighting. All of this is included in safe environment. Now, why is it necessary to have a safe environment? Various studies, various researchers have shown that most of the communicable diseases or the infectious diseases are the result of poor environment, or because of poor environment, the diseases seem to be worse. Okay, so for that, in order to make sure that infectious diseases are not spread all over, good, proper, safe environment must be provided to the individual and to the community. So that is the second strategy of health promotion. So of course, when we provide a clean, safe environment for the person, it is obvious that the person will be able to live in a clean environment, which will affect the health of the person, and therefore it will help the person to achieve health promotion as well. The next one we have is public participation. So we have been discussing about public participation and how important it is to involve public in various interventions that we carry out, right? As healthcare professionals, we have to involve the people in the community from the planning phase itself so that they understand the importance of various activities that are carried out. Without the public participation, any kind of activities that are carried out are a waste of time. The next strategy we have is information and education. So how important is providing information and education? We already are aware about it, right? Information means providing information to people, communicating the right information, communicating the fact about various health related matters to people in order to make sure that people are aware about the problems, people are aware about what is happening in the surrounding, they are aware about what they should do, what they can do, and how they can promote their health. So information and communication is one of the major aspects of health promotion, wherein as healthcare professionals we have to educate the people, inform the people, communicate the right factual messages to the people on various health related matters, and various activities must be taught to the people through right education. Various activities can be taught to the people. People must be educated about various ways through which they can achieve health promotion, the way they live. They have to understand what is causing harm to their health. We have already discussed about health behavior, where we have seen that there are certain behavior in an individual that affects the health of the individual negatively, and there are certain behavior in individual that will help the individual to achieve a good health. So therefore, all those activities which will help him or her to attain good health must be taught to the people. So right kind of information and educating the people at the right time about various health related matters is one of the major strategy of health promotion. Even WHO have given a statement saying that education is the only way through which we can reach out to each and every people to make people understand about the various medical and psychological benefits of medical services, and providing the right kind of knowledge to the people by imparting education to the people for attainment of good health. So from this statement only we can understand how important providing right kind of information and educating the people is. Another strategy that we have is health research. What is health research? Any research is done in the field of health to understand the cause of the disease, to understand the risk factor of the disease, or to understand how a disease can be prevented or treated. All of those researchers are health researchers. Now, health researchers are very important. It must be conducted in order to make sure we understand the responsible factors of ill health and how these factors can be manipulated in order to achieve health. Now, health researches are one of the major strategies that can be used for health promotion. Once we know what are the factors that affects the health of an individual, how will the health of an individual be affected, and what are the various ways through which individual can attain good health, can be known only through health researches. So health researches are also one of the important strategies in health promotion. Next one, we have welfare programs. Now, welfare programs are designed, or it is used in order to make sure that we work towards the well-being of an individual, well-being of a community or a nation as a whole. Welfare programs can be governmental, it can be non-governmental, and various voluntary and non-voluntary organizations must be actively involved within the nation to work towards the well-being of an individual. Few examples of welfare program that we have currently in our nation is midday meal program, reproductive child health, and food fortification. So these are the various welfare programs that are designed in order to help people, community, or a nation as a whole to achieve good health. All of these activities or all of these welfare programs are carried out in order to help the individual, in order to help the community, society, and nation attain good health. As I said, various governmental, non-governmental organizations are involved, and they must be actively involved within the nation to provide welfare program to individual, community, and society. So it is the responsibility of these organizations to also evaluate if any program is administered. If there's any kind of program that is started as an organization, it is their responsibility to look after the effectiveness of this program, how well this program is able to achieve the goal, and if there is any kind of shortcomings, what are those shortcomings, what can be done in order to help people achieve good health must be evaluated by these organizations. And finally, we have healthy lifestyle. So of course, healthy lifestyle, as we have been discussing from the very beginning of community health nursing, healthy lifestyle will help in reducing the mortality as well as morbidity rates. Healthy lifestyle will help the people to attain and maintain good health and also restore good health. Healthy lifestyle includes following a nutritious diet, a balanced diet, carrying out various physical activities, staying physically active, and also performing various activities such as yoga, meditation, or other relaxation techniques. So these are the various health promotional activities. Under health promotional activities, we have various strategies that are to be followed, and that includes proper healthcare systems, safe environment, following a healthy lifestyle, social welfare programs, health researchers, public participation, and the most important, information and communication. Now that is all about health promotion. Let us move on and see a very short and interesting topic, that is health maintenance. Health maintenance is also related to health promotion. Let us see what is health maintenance and how can we maintain our health. In order to achieve good health, so far we have seen that it not only includes curative but includes preventive, promotive, and protective measures. So which means we as an individual must protect our health. We must help ourselves to prevent any kind of diseases, any kind of accident that can cause harm to our health. And also various promotive measures must be used in order to achieve good health. Now, all of these measures, whether it is a preventive, promotive, or curative, these measures are to be adopted by an individual continuously. It is not a one-time activity that an individual performs. If I want to stay healthy and if I exercise for a certain period of time, it does not mean that I'll be healthy throughout my life. It needs to be used continuously throughout the life of an individual. To maintain the health of an individual at an individual level, what can we do? We can follow the right kind of diet. We can manage our stress with various relaxation techniques, proper exercise or staying physically active, stress management, consulting a doctor whenever required. So these are the various things that at an individual level, we as an individual, to protect our health or to prevent ourselves from any kind of diseases, can do. As I said, these are the various activities that we can do at an individual level. Let us see one by one all of these activities. The first one we have is exercise. Now, what is exercise? Exercise is a way of staying physically active or maintaining the health of an individual. Exercise is directed towards physical fitness of an individual, and physical exercise will strengthen the body, the bone, the muscle of an individual. So exercise will help us to remain physically active. It is focused on physical fitness of an individual. It will help to strengthen our bones, our muscles, and our immune system as well. Exercise in heart diseases will also help to strengthen the heart muscles, which will reduce the risk of heart attacks or which will reduce the risk of any kind of heart diseases. Exercise such as stretching, aerobic exercise, and anaerobic exercise can be done to stay physically active. Various stretching exercises will help an individual to also improve the range of motion such as abduction, rotation, flexion, extension, etc. And various anaerobic exercises will help to improve the cardiovascular endurance. So exercise is one of the major aspects of health maintenance, in which the individual can carry out exercises on their own. Various exercises such as stretching, aerobic and anaerobic exercises can be carried out in order to strengthen one's immunity, bones, and muscles. The next one we have is hygiene. Now, hygiene here includes personal hygiene as well as food hygiene. Hygiene plays an important role in maintaining the health of an individual. It is obvious if we are hygienic, if the food that we consume is hygienic, then we do not fall sick often. Now, as I said, this includes personal and food hygiene. What is personal hygiene? Personal hygiene includes various activities one performs: taking bath, brushing, cleaning one's hair, keeping the eyes and ears clean. So all of these activities comes under personal hygiene. Any activity carried out by an individual to keep himself or herself clean can be termed as personal hygiene. Now, personal hygiene will help to eliminate the bacteria that can cause any kind of illness from our skin, and it will also help to prevent the entry of any kind of pathogens into our body. Dental hygiene is also one of the important part of personal hygiene, wherein improper dental hygiene can cause various problems such as gingivitis and stomatitis. Poor eye hygiene can also cause infections such as conjunctivitis. Therefore, we need to maintain a proper personal hygiene in order to have a proper health, in order to maintain a proper health. This all comes under personal hygiene. Next, we have food hygiene as well. Next, we have food hygiene. So, food hygiene is one of the major aspects that will help in health promotion. What kind of diet that we consume, whether the food is prepared in a hygienic manner or not, plays a major role. Food hygiene includes handling, preparation, distribution, and production of food. So it is not just about preparing the food, but it is also about production, it's about handling, it's about distribution and serving the food. So at every step of food production and distribution, it must be taken cut. Ample of care must be taken for food hygiene. Diseases such as typhoid and diarrhea occurs because of unhygienic food measures or because of not maintaining a proper food hygiene while preparation of food. So washing our hands before we eat any kind of fruits, washing the fruits and vegetables properly are all different simple ways through which food hygiene can be maintained and health can be maintained. The next step to maintain health is to reduce stress. Now, stress can be of different types for different individual. It can be because of the family problems. It can be because of the personal problem of an individual. It can be because of the low income of an individual. It can be because of the work of an individual. So there are different ways through which a person may have stress. Different person will have different reasons for stress. But if the stress remains in an individual for a longer period of time, then it might cause various negative impact on the health of an individual. Therefore, it is necessary for us to reduce the stress. Simple stress can be reduced by an individual on their own. An individual can undergo various relaxation techniques to help himself or herself reduce the stress. Various activities such as deep breathing exercises, meditating, going for a walk, listening to music are various techniques or various ways through which the stress can be reduced. So stress should not be there in an individual for a prolonged period of time, because if it occurs over a period of time, then it may have various negative impact on the health of an individual. Therefore, to maintain the health of an individual, stress must be reduced, and there are various relaxation techniques that can be followed in order to reduce the stress of an individual. The next method that we have is health services. Now, as I said, in health promotion itself, health services are the major aspect of maintaining or attaining health promotion. Having a proper, well-functioning healthcare system which will help the individual to understand about their health needs, to understand what they should do as an individual and how they can prevent various illness, how they can protect themselves from various kind of diseases, various risk factors and consequences of the diseases. Consultation with the doctor and other healthcare professionals will help the individual to identify any kind of abnormal changes in the health status of an individual. So proper health assessment must be conducted. This can be achieved only through health services. So proper health services is one of the way through which the health can be maintained. There should be a consultation with the doctors and various healthcare professionals to understand the health need of an individual and also to understand the various abnormal changes at the early stage, to detect any kind of abnormal changes in the health status at the very early stage. Minor problems, even though there are minor problems, even though the symptoms are very minor, if not treated at the right time, if not detected at the right time, it may lead to various other health problems. It may cause various other health problems. For example, a small nodule in the breast can be benign and it can be removed by a surgery, right? So it is just a small nodule in the breast. When it is detected early, when we consult with the doctor at the early stage, it is at benign state and it can be removed and it can be treated. But when it is left untreated, when it is left undetected, it may later cause breast cancer. So small problems may contribute to big problems. It may lead to various illnesses in later life. Therefore, at a very early stage, there is a need to detect the health problem of an individual, and in order to detect that, we need to perform health assessment as healthcare professionals. Therefore, health services are one of the major role in health maintenance of an individual or a community. And finally, for health maintenance, again similar to health promotion, we also have safe environment. What is a safe environment? A safe environment is the environment in which a person has adequate amount of good water supply, good lighting, good ventilation. The area is free of any kind of rodent or insect. There is no pollution in the environment. These kind of environment will help in health promotion as well as maintenance of health. If the water supply is not proper, if the environment that one individual lives in is not proper, then obviously it will contribute to various illness in the individual, and it will cause harm to the health of an individual. Along with the good water, ventilation, lighting, and proper and a safe environment, individual should also have a good social interaction with one another. People should have a good social interaction with one another. They should be satisfied at their workplace as well as maintain a good and healthy bond with the people in their community. So all of this will contribute to the health of an individual. These are the various factors involved in health maintenance. So health maintenance includes safe environment, reducing the stress of an individual, following a healthy lifestyle, diet, hygiene, and exercise. To summarize, today we have discussed about health promotion, various strategies of health promotion and health maintenance, under which we have seen what can we do as healthcare professionals for attaining health promotion and what are the various ways through which individual can maintain his or her life. I hope the class was helpful, and this brings us towards the end of the first unit, that is Introduction to Community Health Nursing. From the next session onwards, we will start with the second unit, which is eugenics. Thank you and have a great day ahead.